I've just come on to talk about breastfeeding in general. Obviously, some of you already got babies and some are expectant, first-time mums, the whole gamut out there. So I'm talking from your point of view as a lactation consultant. On the wards at the Marta, we have a lactation service, so that you're having any problems with your baby with feeding, you can contact a lactation consultant. We also do antenatal classes, so you can come along and see us. If maybe you've had problems in the past and you've got concerns, you can make an appointment to come and see us at the Breastfeeding Support Centre. Okay, we have a stand over there for the Marta, so you can come afterwards and I'll be there for about half an hour if you've got any particular questions that you want to talk about one-to-one. The first thing we're going to talk about, if I can work this, yes, skin-to-skin contact. So it's really important when you have your baby, whether you're having a hopefully vaginal delivery or if you need a cesarean section or your baby's in the nursery, you get to do as much skin-to-skin as possible. So I've got my baby here. I've also got my breast here as well, but just to show you that babies, breast, you'll get used to this, you'll see lots of these, or your own. So with babies, we like to do skin on skin, but skin on skin means actually babies down to the nappy, so we don't want baby, if you're going to do some skin to skin, wrapped up with a hat on, layers, and then try and do skin to skin. Anybody heard of skin to skin before? The importance of it? We use it for even tiny little babies in the nursery can do skin to skin so that it can be close to mum. Babies naturally want to be close to you. They want to feel your body. They've been used to being in this position all snug inside. So when they come out, where do they want to go? They want to go home. And to them, this is home. So if you have your baby, I'm going to strip this baby off. It's got no nappy on, but anyway. It's a bit dangerous. Always keep the nappy on if you're doing skin to skin. But if you have your baby here between the breasts, that's a way of making your baby feel nice and secure, okay? There's lots of research out there to show you that babies actually use skin on skin will help to maintain their temperature. So if you think, oh, the baby will be too cold, you can always put a cover over the top. In some cultures, it's considered that you shouldn't have your baby stripped off, but your breasts are pretty amazing. If baby's too cold, they've done thermoregulation, the breast will start to warm up and babies will start to maintain the temperature. The heart rate will settle and they'll just feel secure. Plus the fact it really feels nice to have your baby here, okay? So hopefully when you have your baby, either it's a Caesar or you've had normal delivery, you'll have your baby close to you here and that will really help with that breastfeeding, okay? So it's just one of those things you can do. And babies, if they're here, they will usually settle. So if you're not sure if your baby wants to feed, that's the other question I get asked a lot. Well, how do I know if my baby wants feeding? If you put them here, if they just lie there and go to sleep, that's a sign they're not really interested. But if you see them starting to turn their head, bobbing down, the ladies that have already had babies remember that, looking, yeah, that's right, mouth going, working their way down, that's when they're interested in a feed. Now for dads or potential dads out there, you can still do skin on skin as well. It's an excuse for us to get you to all take your tops off, and so you can have babies here as well, dads, and work down towards the breast, okay? Obviously you're not going to feed the baby, but it's a way of bonding as well for babies to get to know you as well. They've been recognising your voice in utero. They've done research that shows that guys are actually better at settling babies. So it's always a good bit of research, mums, to have 3 o'clock in the morning when your baby's not settling. Just tell dads, the research says you're better at this, okay? Guys have got a deeper voice and also they've got Adam's apples. So if you have your babies here, guys, that will start to settle babies. Once they start to work down and find the breast, that's when you hand them back to mums. Okay, so it's one of those things that you can do. That skin on skin is really important. Okay, I'll go on to the next one. I don't even know what it is. Okay, so those that have had your babies, as I said, babies will start to look for the breast. If you're not sure if your baby wants to feed, if you just put them here, if they're starting to turn the head, looking around, that means they're interested in feeding. So you don't want to wait until your baby's screaming in the cot to try and feed them, because what's going to happen there is that you're going to get stressed, then the baby picks up on it and they get more stressed, and then you get more, and it gets worse and worse, like a tornado of upset. So you want to look for those early feeding cues. Anybody got any ideas what would be an early feeding cue, a reason that your baby would want to feed? Yep. Sucking the fingers, looking around. They have a really strong sense of smell as well, so they know that where to find that breast milk, which is why if dad's got them, they won't so much go looking for that breast. But if they're here, they'll start to smell and start looking for it. The colostrum has a similar smell to the amniotic fluid, the waters, so they recognise that. That feels like home. So you'll see babies trying to work down towards to find the breast, okay? Turning the head, sniffing, licking their lips. Those are the early feeding cues that you want to look for with your baby. So just if you have your baby here, if you see the turning the head, then let them work down towards the breast. You don't always have to try and get babies into a routine and feed them every 3 hours or every 4 hours. In the early days, babies will let you know when they want to feed. If it's your first baby and you're struggling, anybody like and being an expert at putting the nappies on, you tend not to be with your first baby. If you've already experienced those times when you put the nappy on, pick them up and it falls off, or or they wee out the side of it, or you lift their legs up and they do more poos and things. So if you're finding that some babies will gradually wake up and let you know that they're interested in feeding. Some babies are very placid and they'll turn their head and go, yeah, hey, come, we'll get there. Other babies will go from 0 to hero very quickly and want to be fed like now. So if you can not change the nappy before a feed, if you've got a baby like that, and then they won't get upset. So then you're just looking for those early feeding cues and bring baby close into the breast, okay? There's lots of different information that'll be given about how to feed your baby, but the basic principles are if you do what we call baby-led feeding, that's the best way to start with the feeding. Anybody heard of baby-led feeding? No? So any mums here had more than one baby, had a baby already? Yeah? You're all new mums to be? Okay. So the best way to start to encourage your babies to feed is if you have your baby between your breasts, just in a nappy, and baby starts to show some interest, work down towards the breast. Rather than, you don't always have to be sitting here, get the breast, like this kind of position, or this kind of position. Babies naturally know where to go. It's not like they don't sit in the utero, read a manual, on page 32, now I need to work down, and then I open my mouth, do this. They naturally know where to go. So if your baby is here, you don't want to be sitting upright like this, but if you relax a little bit, babies will start to work down towards the breast and find the breast themselves, okay? As long as they've got that space to do it. If you've got them wrapped up in 3 layers and a hat, they can't really do that. But if you're relaxed and you've got your baby here, they can actually work down to the breast themselves. They might get down here, have a little sleep, have a rest, that's fine. They might be a little bit mucousy, a bit upset, but then eventually they'll start to work down. And it doesn't matter what size your breasts are. This is a larger size breast, but everybody's got different size breasts, different size areola, nipples, okay? So whatever nature's given you, they tend to work together. So baby comes down, finds the breast, they will put their chin well in and they will lift up and go onto the breast that way, okay? So as I said, there's very different ways that you can position your baby, but the basic clues are the same. Baby needs to be supported behind the shoulders, brought close into the body, and they will naturally open their mouth up and get onto the breast that way, okay? Hopefully. If you were having any problems, I'm just talking on a point of view at the mater, you would get your midwife to help you, but if you've got other concerns, then they would refer you to one of us, a lactation consultant. A lactation consultant is mostly our hospital, they're midwives, but people who've done extra training in breastfeeding, so it's our particular interest. So we can see you on the wards if you're having any problems, but if you need to come back, you can come back in as an outpatient. We have a breastfeeding support centre where you can come back and see us for a one-to-one consultation. Okay, so anybody heard any things about breastfeeding they've got concerns about? No? So you're all thinking it's going to be fine and easy, or?
How do they treat cracked nipples nowadays?
Nowadays? Oh, we don't have them. It's not a normal thing to have a damaged nipple, so don't think that you've got to sit there and tolerate the pain because some auntie or grandma, or not you, but you know, some other person said, oh, that's normal, just, you know, you've got to toughen up or scrub them or whatever. It's about making sure that baby's latched onto the breast well. So the main thing we encourage to use, if you have a little bit of tenderness, is to use some of the colostrum. You know that the milk that you first get is the colostrum, and then actually to squeeze a little bit of that and rub that onto the nipple and let that air dry. But if you were in the hospital and you were having problems and you did have damage or cracked nipples, then we'd be wanting to have a look and see how baby's latching at the breast. So it's about baby coming onto the breast rather than you see people trying to force breast into baby's mouths. Babies aren't silly. If you offer them like that, they're just going to get onto the end and cause damage. So don't ever think that you've got to toughen up or, you know, deal with it. There is support out there. So mostly we're recommending that you just use colostrum because it's pretty amazing stuff and it will help with the healing process. But if you were having any problems, you would contact somebody to check out why is this happening. You shouldn't have damage on the nipple, you shouldn't have ridging on the nipple, you should just have the same as whatever's normal for you, only a little bit longer after the feed. So always get used to, it's not any other time that you're going to be touching your breasts all the time and checking your breasts out and making sure that they're all okay. So just get used to handling your breasts when you're pregnant. If you've got issues antenatally, you might have inverted nipples, you might have gestational diabetes, things like that that can sometimes cause issues further down the track. You can always come and see a lactation consultant antenatally so that we can help you with those problems before you actually have your baby, so you're prepared for what's happening. Going to move on. Okay, I've already talked about this a little bit, this baby-led feeding. In the old days, which is probably when I trained, it used to be that your baby, well, in the very old days, it used to be that you would feed your baby for a couple of minutes on one side to start off with, and a couple of minutes the other side, and you would feed scheduled feeding every 3 hours or every 4 hours. But what we actually say now, that the baby's kind of in charge, they know what they want, they know what their requirements are. Babies don't need a lot initially to start with to eat. So if you were comparing breastfeeding with bottle feeding, you would see that with breastfeeding you're only given a small amount to start off. When you get the colostrum, there's not a lot of it, but what you do have is really high quality. Okay, so lost child. Okay, so this one here that I've just got here, I don't know if you can see that, that just shows the size of the marble there, that small marble is the size of a newborn baby's roughly stomach. Okay, so they don't need a lot to start off with, tiny, which is why nature provides you with colostrum initially. Round about day 3, 72 hours, starts to get bigger, because the more you produce, the bigger baby's tummy gets. It's like a balloon, gets bigger. This one is supposed to show, which one, that one? An adult stomach, which is a bit of a worry really. When I look at that one, I think I'm more like a soccer ball. But anyway, that's supposed to show, like, so you can see how you don't need a lot to start off when baby's born, because if you give baby too much, you're stretching that tummy. If you give them a large volume, and they can vomit and things like that. So initially you're not going to have a lot of milk. When your milk comes in, you get larger volumes, and that's when you get quite full with the milk. You sure? Yeah, babies, if they're feeding on the breast, they'll either drop off and if they're fed well and do that drunk on breast milk, or they'll just lie there with the mouth open going, this is great, I love it. And then you'd actually need to put your finger in there just to help to tease them off. Otherwise, they'll be dragged across the room with the breast as well, which is not good. So yeah, the babies will let you know. So it's not so much about looking at the clock and seeing how long babies are feeding for. Babies kind of let you know. So babies tend to cluster feed initially, so they might feed every couple of hours, hourly, then 3 hourly, 2 hourly, no set pattern. As they get older, they'll start to get into more routine, but we used to do this every 3 hours you must feed, and it's like you might want a snack, then you might make a big meal, then you might want, you know, starters, main, dessert. Depends on the time of day. So there's no set pattern initially. So it's just kind of, the more you skin on skin you do, the more that encourage babies to feed. Okay, so I've talked about the first few days. One of the ways of knowing that baby's feeding well is the output. So you're going to be looking at nappies a lot. Marta does make nappies now, just thought I'd add that in. So you want to look at how many wees and things you're going. So when you're looking at this and you're looking at how small baby's tummy is, then you're not going to have a lot of output in the first 24 hours, but that will increase as you have more going in. Okay, so you'll be looking at baby's nappy and seeing if they're wet, and you can feel the weight of the nappy to see if they've weed and when they've pooed. It's all very exciting when baby does their first wee and their first poo. And then by around day 5, they should be having nice yellow mustardy looking poos. Pesto mustard, chocolate pesto mustard. So that's put everybody off food for today, but that's what you'll be looking for, and it's good to practice before you have baby. But that's a way of knowing your baby's having enough. And you need to make sure that baby's feeding well at the breast, that they've got a nice wide mouth, that they're coming onto the breast and they're not sucking in their cheeks and kissing the nipple. You want them to be well onto the breast, big wide mouth, and doing nice deep latching at the breast. Babies will let you know when they're interested in feeding. Obviously when you're in hospital, if you've got any concerns, you think baby's a bit sleepy, they might be a little bit jaundiced, you heard of jaundice, So then your doctor or your midwife might just say you need to try them, feed them a little bit more. But in general, in the first few days, it's just getting to know each other. And if you're not sure if your baby wants to feed, then you'll just do a little bit of skin on skin and bring them here. They'll either fall asleep because they love it, or they'll start looking around. And then the second night, we have a lot of mums that I see at the breastfeeding talks. We do breastfeeding talks every day via Sunday at the Marta. You can come along. We have a talk for half an hour, and then we have a clinic. So if you're having any problems, we can check things out, help you with attachment. But you can tell when mums have had the second night, because they're usually the ones that like this, because second night babies tend to wake up more and suddenly decide they're getting a little bit hungry and they want to feed a little bit more frequently. So just it's kind of going with the flow and let babies decide. But look at baby's output and just bring babies close into you. Try and do as much skin on skin, because that's the main thing that we talk about now. We used to be very set in about how you had to have the baby. You'd need like pages and pages of how to get there, but it's just kind of like going what feels natural for you. Okay. And that's again demand feeding, baby-led feeding. So it's just looking, as we talked about before, those early feeding cues, seeing how long when baby's wanting to feed. Okay. So not trying to get them into a schedule, get them into a routine. Routine is the R word, I call it, is a dirty word really for me. It's just about letting babies go where they want to go, what they want to do. Okay. Any questions about the feeding? So nobody's had a baby already? No? Oh, it's all exciting. You'll see if there's any. Again, I've probably stepped over myself here again. Well, how do you know that baby's getting enough? Well, obviously they're on the breast. They've got that big wide mouth, and you've got good output as well. Okay. So just any questions? We've got a stand over there, which is, I have to write it down, M29. I'll be there for about half an hour afterwards. But anything about the feeding at the moment that you'd like to know about? Pain? No, shouldn't be painful. Again, the same with the cracked nipples. If you're experiencing pain with feeding, that's not right. There's something not quite right with baby's position at the breast. So you will feel a pulling sensation when baby's coming onto the breast, but it shouldn't be painful. It shouldn't be like clamping, and it shouldn't be sores. You shouldn't be curling up your toes, hearing the theme from Jaws in the background. That's all signs that things aren't quite right. If you're holding your baby like this, there's something not quite right with the feeding, as in we need to look at how babies latch into the breast. But if you're not sure, just bring your baby here and let baby work down towards the breast as well. Unfortunately, we're not very good to each other, and people will tell you horror stories about bleeding nipples and, nipple was bitten off and all this kind of thing, but it doesn't happen. Sorry. Thank you for your time. It's very quick, but as I said, we also have got some vouchers here. We also have the clinics that you can come to at the Marta if you're having any breastfeeding issues. We've got a whole centre that you can, if you go to the website, you can find our information.